Thank you so much, Praveen Varkey, for joining us today. And thanks, everyone, viewers, for listening to the Learning Beyond Borders podcast. And I have a very special guest today here, Praveen Varkey, the founder and CEO, Ontario Heroes Health and Social Services. How are you today, Praveen?
I'm very good, Aparna. Thank you so much for this wonderful opportunity.
Thank you. So, how is your day going so far?
Too busy as usual, but almost end of the day.
Well, that's
So
great.
we are here to just chat with you today.
Yes, yes. It's going to be interesting. Of course, it's a very interesting topic about social services and community engagement. Praveen, it's a great opportunity for me too. Talking about Ontario Heroes and its services and more to talk.
Sure,
And
sure.
yes, wonderful. So, talk about. I would like to hear about you, Praveen. I hope you are also an immigrant or a newcomer to Canada. What actually, interested you to start Ontario Heroes?
Great. That's a very good question. So by profession, I'm a social worker. I immigrated to Canada in 2011, 11 years ago. And after a few months, I got a job to start as a social worker. So that's the beginning of my career. So I started my social work practice in Canada in 2012, April, after 4 months of landing in Canada in a rehabilitation facility as a social worker. Then a few years I continued, I learned the system interventions, and later I worked with Ontario Health. That's Home and Community Care, previously known as CCAC LIN. Then after that, I gained a little bit of experience working with the system, assessing various programs and services eligibility for OHIP covered services. Then I got a little more insight into the system, how the system works. Later, I joined in a hospital, so with the Peel Memorial Hospital, William Osler Health System, almost 5 years now. So I got an exposure in three various segments in rehab and also in a long-term care home setting, working with elderly and also home and community and the hospital. This is the main three streams. And the beginning of Ontario Heroes, we were actively involved in volunteering and supporting our newcomers and international students. So we were a small group. We were doing this a couple of years prior to the pandemic. So we had a good network, or we are very well connected to our community members, newcomers, and immigrants that point of time. And also, I worked in various sectors. We have a very good people I connected with. Like they're very professionals, very compassionate people. They're very much interested to support the community or guide the people. So we were doing this on the side, not as a registered way, just informal way, supporting people whenever we get a query. So we connect people, we help with job linkages or reference or all those matters we were doing. But during the pandemic time, so we got a lot of queries within our community from our friends and international students, even associations, they approached us. So there's a lot of things going on, misconceptions and about spread of COVID and also vaccine and also the misconceptions. And that time they started calling us, and also on the other side, increase in number of mental health cases, addiction, missing, death, and also a lot of other issues. They need counseling support, they need a lawyer, and they need a lot of guidance and support and counseling. So we decided, no, we cannot handle the way we used to do, because that time we were doing informally, but the cases coming in very much intense. Domestic violence cases, criminal cases, mental health, addiction, motor vehicle accidents, and those child issues and separation matters, that all need proper coordination. And also we have to work with the system. Most of the time we are working with the correctional setting, police and hospital and the coroner's office and consulate and associations, organizations. So we decided, no, we cannot work. There's a huge liability and there's a lot of other matters we need to take care. Then we decided to form an organization, and that platform where the people can come and access services. And we devised a volunteer platform, and where the professions can come together and share their knowledge and expertise. So we devised a platform and we registered this organization in 2020 October as a non-profit. So we are a federally registered non-profit organization. When we started, we had 100 plus volunteers on board. They are from 30 disciplines like doctors, nurses, social workers, lawyers, pharmacy, dietitians. So we have all disciplines on board, and they are from different diverse background, like 16 nationalities, and we do have more than 16 or 17 language support that time. So we had a crisis line or telephone line. They can call us, and also we had a mobile application and website. So we implemented all the platform. People can reach us out, and we were very well connected with our organizations, associations, and community members and people. We started receiving a lot of referrals, and even forming a group, coming as an organization. Still, we had an overflow. That time, we were trying to address almost all the calls. Then we had a mental health support. We have specialty people on board, doctors, nurses, social workers, even some of them work in mental health setting and crisis line. So we had that knowledge and expertise on board, and we tried to address and we tried to navigate, and also ultimately we ended up with partnering with many organizations because we need an outlet for continuation of care. Then one session, two session, we can do it. We can do the intake, we can assess, and we can navigate, but still they need a continuation of care. So we partnered with many organizations that helped us a lot to provide continuation of care and take more referrals and support our community people in time. So we did everything free of cost, a volunteer driven platform, and we brought all these people to come together, share their knowledge and expertise, part of a community giving. So in last 2 years, we did 18,000 hours of professional consultation and supporting or giving back to the community, to the Canadians, not only the international students, not only the newcomers. We supported various people, in permanent residents or citizens or seniors, whoever come through the platform, asked or raised a request for the support. We did it, and also we were actively involved in community development. We support other organizations and other community too. So we developed many programs even during the pandemic time. So we had a virtual summer camp. Even when they give some relief, then we had a in-person soccer camp and a volleyball camp, and we had a kids fest, and we organized many events to engage these people and give an opportunity to come together, meet and greet, and also networking. And other thing we did it, especially with the computer college and other students, they were seeking for the placement. So there is very less opportunity these students can get the placement. They were finding challenges because of the COVID protocol, and most of the organizations they changed the normal way of operating. So that's the time we picked up a lot of requests from many colleges, including computer college. We placed a lot of students and we trained them in a better way, and 100% people employed because we had a multidisciplinary team, and also we had a specialized group of social workers. So they had that knowledge set working in various sectors. We brought them in and we trained our CSWs, and they have wide knowledge about assessment forms, community resources, and scope of practice in various settings. And beyond that, we extended mentorship programs in 30 areas. So, for example, if you're an internationally educated pharmacist, dentist, social worker, nurse, or any field, so we have the resources on board and we matched that, and we did webinars and we did one-on-one sessions primarily to talk about the licensing process, scope of practice, or clinical practice, or the process about obtaining license, and also guiding them and helping them. So that mentorship program helped a lot of people to obtain their license and get connected with the people from their profession. That networking piece we enabled and we connected with the people. So we managed to build a community out there. The people are very well connected, international students or professionals or even local community organizations or employers, and there's a hub we created. Easily they can access, and there's no cost for the services, and we have no systemic barriers or no wait time. And they're all good people. They're strong, they're professionals, they're knowledgeable, and they know the practices, what's happening as of today. They follow the policies, they know about confidentiality, and they maintain everything, and no micromanagement is needed because they're all professionals, they know what they do. So we developed a system, and students, when we take these placement students, we trained them appropriately how to respond to these queries, and we did a lot of case reviews. So they had that insight. When we get a case, what's the process to follow, what's all about privacy, what's all about confidentiality, what is psychosocial assessment, and what are the resources available, and how do you navigate the system, and how do you initiate a referral, and where is this resources available, how do you identify. So that helped a lot, even to reach more population, because we had a lot of queries on queue. But when we trained these students and we converted that resources also to serve the community during the pandemic time, and most of the students that time we accommodated from computer college, and they're all outstanding students. They had diverse background. There are social workers, there are nurses, there are banking people, there are bakers. They're from different background, educational background, but we train them in a way they can end up in their profession. And that's the educational piece also. We taken care to groom our upcoming community service workers. I think it's a lot of information in no
Oh,
one
that's
place.
amazing. That's amazing to listen, Praveen, about your, how you humbly started this profession with your interest and how it has grown so well, where you've been able to say, serve so many students and, international students and newcomers. And this is amazing. I'm so happy to, talk to you about this growth and your service to the community, Praveen. Saying that, I was, so interested to talk a little bit in detail about the diversity you were mentioning.
Mhm.
So I see there's your pool of professionals working with you, having a very diverse industry knowledge as well as a professionalism in their industry. Talk a bit about, how multiculturalism is, involved in Ontario Heroes, catering international students coming from a diverse group of cultures. How do you cater that need for your community?
Yeah, so that's a very good question, because the Ontario Heroes platform, we always promote the diversity, equity, and inclusion. So since beginning, as I mentioned, we have 16 nationalities on board. So we have the people on board, very kind people, compassionate people, and they're willing to help. And they took over the piece of explaining that cultural aspects, that integration piece, like Canadian standards, or how we can easily integrate, because the international students, they have limited social network or access to other community or other people. So we enabled that platform. These international students can communicate with our board members, communicate with our frontline volunteers, communicate with our directors. They're from diverse backgrounds. So we hosted a mega event last year. It's Heroes Fest 2022. So that event, we had a participation from many nationalities and many communities. So there are people from European, there are people from other continents and Caribbean and many other countries. So they had that opportunity to interact with them, open-minded, free talk, and that experience, they realize there's a value of talking, sharing the knowledge, sharing their values, and understanding them. And they also ask us, they're very curious to know about what we do, what's our culture look like, and when, especially about parenting, cultural conflict, there are a lot of things. So but we always follow the Canadian standards, but how you can adapt that values, adapt the system, how easily you can transition. So those people, actually very friendly people. So we told them, see, the international students, they're just coming maybe after completing their grade 12 or some complete bachelor's or some master's, but they're coming to a new country. So they need to understand even the local community. And even some of them, even I'm still learning about the Aboriginal community. So likewise, but I have a few opportunity to meet with them. Even still I'm learning. So I talk to them, I met with them. So likewise, whenever they come into this Ontario Heroes platform, they are getting this wide opportunity to talk to the interdisciplines. You mentioned there are industry experts are there, lawyers, teachers, engineers, and doctors, pharmacists, dietitians. So during that time, even we brought lawyers in to talk about power of attorneys, to talk about the privacy law, and we brought the doctors in to give education on chronic disease management, and we brought other disciplines, occupational therapy, talk about mental health, sorry, not mental health assessments, memory assessments, MOCA, and we brought social workers in to talk about the practice. They are from not only Indian heritage, they are from other community members, and they're all working in Canadian system, different organizations, or with the Ministry of Health or hospital, or they have independent practice. So that platform, that industry experts from diverse background, we utilized very well to groom the international students and newcomers, because we bridge that path and we enable a better platform where these people can come together. There's no problem. This everybody is equal, and they're all volunteers and they're friendly people. And these students, they are seeking for support. They are seeking opportunity for networking. They are seeking knowledge transfer or to learn from them. So that diversity piece helped us very well, even to reach beyond what we expected, because we have people from Philippines, or we have people from Croatia or Ukraine or Poland or Britain or Jamaica or Korea, and many nationalities. So we able to reach even their community. So we used to get referrals from them, or we attend their functions and we invite them to come and celebrate the culture and diversity. During that Heroes Fest, we had performances from different population, different cultural background. That's all new to the newcomers and international students. So they had an opportunity even to meet with them, talk to them, take pictures, and even to establish good connections.
Amazing, Praveen. I think you touched really in detail about the diversity, how you're, supporting diversity through your organization, and I think you also indirectly tried to, highlight the importance of networking. So I would like to know a little bit talk to you in detail about how networking is supporting newcomers, how important it is to network to, towards the profession as a CSW, community service worker, and as a newcomer. Can you talk a little bit about it, how networking supports people?
Definitely. So networking is the key in Canada, especially in order to like professional development or job search or developing new skills. Networking is the key, because that create a lot of opportunity and avenue where you can engage, in order to build your skills or leadership opportunities or employment opportunities. You get a number of opportunities when you network. So networking with interprofessionals, not only CSW, they can socialize or network with SSWs or social workers or other professionals, or the community members or associations or organizations or other disciplines. So you are expanding, or like opening up yourself to grab the more opportunity. So through that, you can get information about employment. You can get specialized or training, or when you do a resume preparation, or when you go for an interview preparation. So you get that industry expertise coming over and helping you out. If you ask a question, they will tell you exactly based on their practice or based on their expertise, they will help you how to answer this question. So, and also that people, when you network, they will send you the information. Oh, there's a job coming up, or there's an opportunity like this you like to grab, or there's a volunteering opportunity you like to join our board, or you like to volunteer in so and so facility, or programs coming up. There is a lot of opportunity when you network. If you don't network, you are very limited, because where do you go and search the information? Because reference also, it's very valid. In Canada, networking and reference is very important. So even volunteering, that's one of the beautiful thing you can do being in this country. Giving back to the country and same time you're learning a lot of things. You can gain reference and also that way you can access their employment information. So reference or linkages, it's all possible through the networking only. So small group networking or you can attend big events, but
Mhm.
still in the big events, the outcome is only we can meet very few people, but small group meetings and networking sessions, it's always good. I saw many agencies host networking sessions with high profile people or open to all community members, but its entry is restricted. They allocate, okay, maybe 5 or 10 industry leaders, and we allocate 5 or 10 newcomers or 5 or 10 international students. They get a mix of population. Also they do only for the leaders or only for newcomers. So there are different level of networking groups happening in GTA too. So I used to go and attend and I expanded my network too. So meeting and greeting new people is always worth it.
Amazing. That's a great piece of advice for any student or a newcomer, for even for professionals in any industry. Networking is the key. And thank you, Praveen, for sharing your, comments, valuable comments here on that note. And again, I was just curious to understand a bit in detail about the opportunities, Praveen. Before we go to the challenges, I want to ask here for our students, what you would like to say in terms of the career growth and career dimensions in the community services space.
So in educational perspective, this is just a foundation course, right? So they have to continue studying or they have to upgrade like a specialized assessment tool or some other skills they have to earn it beyond a CSW can flourish their career. There are employment opportunities, of course. They can work in group homes, they can work in addiction or mental health settings. There are shelter homes, there are senior homes, the day programs for adults with a disability or seniors, senior day programs available, and newcomer center, employment center, there are youth center, and there are many avenues, especially shelter place, community outreach. There are a lot of opportunities. There are a lot of opportunity for community service workers can engage, but they have to gain the right knowledge and skill in order to engage. Learning about psychosocial assessment, learning about privacy, learning about confidentiality, learning about community resources and how to navigate into the system because there are systemic barriers. So you cannot find a services right away. Sometimes there's a wait time. So you have to complete an application and wait for a longer period, even in order to get into a day program or in order to get an affordable housing or a home care services or a government funding. There are a lot of barriers, right? And at the same time, the CSW, they are working with the individuals with mental health or individuals addiction problems or disability or elderly. They have their own situations, so you are enabling them. You have to have good knowledge about resources or assessment skills or soft skills communication, so you have to improve with that. And also continue education is one of the piece if you like to work with the mental health population. CSW have the basic foundation, but whenever you're looking for an upgrade to your job, what you do, instead of working as a community support worker, you like to upgrade or you like to go to the next step. So it's good to have some additional certifications or additional education. Small things is available, so you can still do, but getting good education or psychosocial assessment skills or those kind of things will definitely help them to launch their career in I mentioned areas like any of the setting, and they can go from there because they gain the experience working with them and over a period of time. But still the education piece is community service worker. But if anybody planning to uh, like professional development opportunities, they can continue study either a small diploma or certifications or additional training. Some trainings are available free of cost as well. Through employer also they give a lot of education and training.
Amazing. That's really great to know that, the different dimensions the students can, continuing education is the key, and, how that can create success to them. Great insights, Praveen. Thank you for sharing. And I also have another question to you. Maybe learn a little bit more about the common challenges the community service space in Canada is currently going through, and how Ontario Heroes is like, addressing these challenges.
So in the career perspective, this is a basic salary, or they get a little bit of improvement, depends on the institution or organization or project or program you work.
Mhm.
But for sustainability or longer term, if you're picking this profession, so you need a career development, and also you have to enjoy your quality of life, right? So you may need pay scale up, because the population you work is not an easy population. The CSWs get involved with patients with mental health or addiction or elderly or disability or individuals in shelter place. So it's not an easy population to work with too. So it's a very tough population to work with, but training them to handle personal self or professional self or de-escalation or managing the situations, crisis situations, that help a lot, because otherwise the challenges wise this our community workers, some support workers get shifts day or night, or that changes. Sometimes they have to work in the nighttime, sometimes evening shift, sometimes day, and they pick up a different shift too. So, and that also not healthy for longer period. If the shift keep doing nighttime, then you have to sleep on the daytime. So if you don't sleep on the daytime, then that affect your overall health and mental health. So your quality of life will be compromised. So there are challenges too, because you're working with a very tough population, and it's not highly paid, but they're paid. An average pay they get it is to begin with, but you have to move on, right? So there are challenges in the settings you do, and also work the population, and also the timing, because there are three shifts. So you need to work in a different shift, especially when you're a newcomer, a new graduate. So you will be placed in a
Mhm.
shift. There are other people, but you get limited support, or you don't
Mhm.
get preferred shift. That's what I mean. It's not intentional, because the system is
Mhm.
running. There's a shortage all the time. So they try to fill in, but that will be day or night. We don't know. And everybody is busy, because everybody they have to catch up. They have assigned patients, and
Mhm.
you will be working with them. You have to equip with the right knowledge and expertise in order to work with the population, live in a shelter or mental health.
Thanks, Praveen. I mean, it's really worth knowing the challenges that new graduates in this profession face, and I hope it might be a hard start, but for sure it's a great opportunity to learn and
Yeah,
grow.
yeah,
Uh,
absolutely.
Yes, so that's amazing to, thanks for sharing that. I'm sure every profession has its own challenges, in terms of its growth. But CSWI, it's a very worthy, a profession, not just focusing on any benefits, but always giving to the community. So it's great to know the amount of, support these professionals provide to the society.
Yeah,
Uh,
employment opportunities are really high, because Canada or the
mhm,
government or the system and the organizations, they need workers. So
absolutely.
there's always opportunity, community service worker or any allied health or any profession, there are opportunities.
Mhm,
So the course is really good, and they need to get that training very well. Otherwise, they get burnout, because they are not trained well, or they don't have enough knowledge to work with mental health patients, to work with the shelter patients or shelter clients, or
mhm,
addiction settings or youth settings. Or they need to get the enough knowledge, and field placement is really really important to know all this. So that's a real experience they gain before they get into the profession. And even the advantage with the Ontario Heroes, they're always available. I get call all the time, or I say in case I didn't respond to the call, please text with the scenario. I don't need any
Mhm.
demographic information. I don't include anything. Just send me a scenario. I have a 58 years old gentleman, and this is a scenario. I'm stuck, or I just want to know a little more so that I can help this gentleman in a better way. Just send me a text message, fair enough. So we provide that backup to the students who completed the placement with us, because that's how they improve. That's how we enabling that worker to help a person. Otherwise, as usual, the normal things will happen, but end of the day, that person won't benefit or end up in barriers, a lot of barriers, because they don't know what to do, or they don't know about the resources. We provide that backup to them. Don't worry about it. If you have a question about legal aspects, we have a question about social service. If you have a question about practice, if you have a question about resources, what to do, then just call us or just let us know, or email or text. Never ever include any personal health informations. Never ever include any demographics. We have very strict instructions to them, but they just send a scenario. This is what it is. So it's easy for us to address. So this is a pathway today. This is the way we recommend, or available resources, or this is the best practice. So we just tell them that ease out the tension, because the newcomers, they need a backup. And many people told me, we don't get that much backup. Who do we ask? Because that is the lack of knowledge in the system or resources. But we look into the Google, but most of the time it's not productive, because
Mhm.
application process, and also sometimes there's a wait time, sometimes there's a fee, sometimes the program is already closed, and we don't know how long it takes for the intake assessment to.
So,
Sometime with the communication also,
mhm.
when we train the students, especially CSW students, sometimes they go for the intake departments and all, or they help the patients, or provide information about referrals or community resources. I always say, if I am a service provider, if I'm assessing services what we offer or the organization provide, then I have the right to determine the eligibility.
Yes.
If you're referring to somebody else, never comment on that. Oh, there is a program available. Okay, go there, you'll get it. No, that eligibility assessment rights are reserved to the service provider. Even we can fill a form, send over to the agency, but they assess the patient and they determine. That's their right. We cannot comment on their services. So we tell them very clearly. So be mindful when you speak about the community resources, or before initiating the referral, I will assist you to complete. There's a program exist. I validated, I talked to them. The
Mhm.
process is, I can complete the referral. You have to provide all the adequate information in your best knowledge, complete and send over to them. But they will call you, the organization reach out to you, or the intake worker will reach out to you to assess your eligibility for the services, because I cannot say how many hours of care you qualify, or you're
Mhm.
eligible or not eligible, and what's the wait time. So you need to tell them, and we need to give the right to that service provider itself. Then only, otherwise, what happens? Oh, you told me that I will get the services from there, but I'm not eligible. Or you told me that I can get every day, but they're telling even I'm not eligible, or I get only one day. Or you told me it's free, but they're selling it's $30. So
Mhm.
I said, no, don't do that. Even you're not sure about the process, what they do. Periodically, everything guidelines can change, fees can change, or program closed, everything happening. So validate it before you initiate, or don't comment on their intake process. Let them do and determine. So
Mhm.
that's a better way to educate the patients and give them the referral. So that's the process we follow, and we tell them, in case you're stuck, it's okay, don't worry. We have that resources available to help you out. So
Mhm.
reach us out. We always tell them, and that's how we get a lot of queries all the time. No scenarios, just we receive a lot of queries inbox and say, we like to know what to do with this and what resources available, who to contact. what to do, then we have the database and we have the expertise. We just review internally and say, yes, there are provisions like this. This is the right agency to go. And so we guide them and we help them even they completed their placement with us. That's the knowledge sharing part. That's ongoing. That's happening.
It's great, Praveen. Great to know how you direct these inquiries to the right, sources at the same time adhering the policies and confidentiality. Amazing to hear that, Praveen. And also, I have one more last question about the evolution of this industry. So, as we all have gone through the COVID, we have experienced different transitions on the way we serve our clients, how we operate our businesses or our services. So I would like to hear how community service in general has evolved compared to pre-pandemic and post-pandemic, and now how things have changed right now.
In a way, it's a very critical question, but I will take it very gently.
Sure.
In healthcare sector, even I cannot name out any organizations or any disciplines, but the care changed virtually, right? So the quality is compromised, and also there are systemic barriers. We are unable to reach the practitioners or reach the office or healthcare facility. So intake was very slow, and also the wait time went very high in order to get an appointment, in order to get an information out. And also sometimes they call from unknown number, and sometimes we don't respond to the unknown number. And after that also it changed because people find easy managing virtually, but the virtual care is totally different. But in a way, it's very helpful for a senior person. For example, a senior person go for a family doctor appointment, they prepare for the day, and there's no drive or transport, so they book the transport or someone has to accompany. There's a commutation time and also the expenses and parking, and they spend a lot of time, and it's almost a half day or full day just for an appointment. That is completely eliminated because now they can get the virtual care, either telemedicine or telephone call from doctor or Zoom call from the practitioners. That made it a little bit easy. But at the same time, during the pandemic time, everything was evolving, and they made it okay, fine, we need to catch up. There's a huge gap, and there's a huge wait time, and there's a backlog, and they did it in that way. But still, some of the offices were unable to reach. Even leaving a voice message box was full. But now we are back to a little bit of normalcy, but still they used with the virtual technology because it's very easy. But in my experience, even still meeting in person, one-on-one, is more productive and fruitful. And the challenges that time, our seniors and some of our population, they have no access to internet. There's no access to cell phone, and they have no access to smartphones. So it was very difficult for them even to access the services. Those people are totally isolated, and even they have a land phone or a phone, they call, there is no response to no services, but finally they end up in a crisis or an emergency situation. So that was another setback during that time when we depends on this technology. But the new generation, maybe they're very handy, tech savvy, okay, fine, they can operate from anywhere, either phone or home and internet, everything is accessible, even they can understand. But a person, a senior person, even language barrier or memory issues, or they have no phone, no internet, how do they access care? There's a huge gap and challenges, but it's evolving, it's improving. But I still say our system compromised a little bit, but 1% of population benefited because they can save a lot of time. And like us, okay, we don't have to commute to Toronto, so just sit in your room and talk. It's fine. So we are saving a lot of time, energy. It's more productive too because we are more relaxed. We don't have to drive in traffic and pay the parking and all. But on the side, there's a population out there. They have no access to any of this technology. So how do you cater them? Are healthcare workers prioritizing them? I'm not sure about it. And they try to reach, they try to communicate, but still is not effective. And they cannot go to the family doctor's office, or any of the office is locked due to COVID related restrictions. Now it's they taken out all the restrictions, still there are some barriers.
Mhm.
So there's a lot of differences. Education piece is different. Education piece, there are challenges, there are advantages. So the challenges, that time, the students, the placement students, they were not getting any hands-on experience. They were not able to go to a facility where they can get the right training and right patient interaction and case reviews, and everything was restricted. So
Mhm.
they are completing the course, they're virtually participating, but they missed a huge piece of interaction with patients or working in a facility, how it looked like, and all about it. So it made a different pathway, but for the placement students, always getting in person is one of the best way to gain the knowledge, skill, and expertise. Virtually, they can do hybrid also help, because some
Mhm.
people live in a far distance. So it's not easy for them to commute for for a day to do this placement in different places going back. There are challenges too, and getting a right placement in right place, there are challenges, but virtually we managed, but we provided the backup, because when they get engaged with the client, a real
Mhm.
scenario, real person, they're stuck because they don't know what to do. That's we realized that, because because when we trained, we said, don't worry about it. We know when it's a real scenario, it's not easy. So it's okay. Don't call us in with a patient present, or but you prepare yourself, or give some room, or grab some time to respond it, and you prepare yourself. So we always give the backup, but we follow all policies in place. Even if somebody sent any additional information, we say no. We don't engage in that way. Only you call and tell me a scenario. I don't need any diagnosis. I don't need any conditions. I don't need any any information, any demographics. No, never ever do that. Then we are not going to encourage or entertain or respond to you. No way. So, but
Mhm.
scenario you ask me, okay, fine. I'd like to find out a resource for a person with autism, or a senior person, or this person. Fine. So we'll guide you. We'll tell you how to go for it, and we can connect with the local people. We have regional coordinators. We have social workers in each region, other disciplines on board. We connect with them so they can have a little knowledge in local resources as well beyond us.
Amazing. That's really good to know, Praveen, how the COVID has impacted towards our service system, and at the same time how it's impacting different populations. In a positive and a negative way. I think hopefully this will further evolve and going back to an hybrid, and currently we are mostly like hybrid, and how this can benefit all different populations to ensure that they are all assisted and they are heard. So amazing, Praveen, and I think it's a great conversation that I had with you. And it's amazing to see the growth and our students from Computech College being partnered, for placements at Ontario Heroes. We are very eager to witness the success, from our students joining Ontario Heroes as well, uh, on an active basis for community services. I really appreciate your time for joining this podcast today. Thank you very much for sharing your thoughts and suggestions, Praveen. We truly appreciate your time and participation. Thank you
My,
so much.
yeah. My pleasure. So, thank you so much, Aparna, and thank you so much, Computer College, for this wonderful opportunity. And I'm so glad the students from Computer College sent over to Ontario Heroes for the placement. They're all amazing students. They had the good caliber, and they had the background or knowledge or expertise. So they were eager to learn too. So we made the connections, and we made available of all the resource people, and they went beyond learning all
Okay.
those. So that really really helped to launch their career and obtain their licenses or flourish their career. So that was a great experience, because first time we started placement with the Computer College. because Betsy was actively involved in all our activities. She's an active volunteer too, and she's connected with us. And that pathway really helped because the communication was easy, and we really like to know that sessions went very well and the students placed and they gained out of it. That was beautiful to know. And I heard one of the testimonial from a student too, and many people, many students actually passed out students, and they told me they're placed in very well. They're doing very good.
Great. It's great to hear the success from your side, Praveen. For the college and our students being very successfully learning hands-on, which is very important. I
Thank you so
really
much. Yeah.
And thank you so much, everyone, for listening this podcast today. If you find our podcast useful, please subscribe to our channel and show your support. Let us know your thoughts and ideas in the comment section. See you all next time with another interesting podcast. Thank you. Bye for now from Abarna Jayaranjit, Operations Manager at Computech.